Okay, well, thank you all for being here. I think this is shaping up to be a wonderful event so far. As a pain psychologist, I help folks with migraine and other chronic headache conditions learn to manage their pain with lots of different non-medication approaches, and it's tailored to their unique needs. What all of these approaches have in common is their basis in the mind-body connection. So the three strategies that I'm about to share with you are less tips and tricks in the sense of quick fixes, but more themes of the work that my patients and I embark upon in the challenging process of managing headache. You will not master these strategies in one day, but they're well worth investigating as part of the larger process that's a process of self-exploration and self-determination that's critical for achieving empowerment and agency with respect to your pain. So I don't have to explain to any of you how challenging, how difficult, how painful it is to live with chronic migraine. Whether it's the frustration of delayed or misdiagnosis, or the dysfunction, not being able to do the activities that are important to you, or the sense of isolation that comes from being misunderstood or being left out because you're in bed all day. These are just some emotional reactions, emotional struggles that chronic migraineurs suffer with. And these strategies will certainly help with the coping of those emotional elements of your suffering. But they're also going to be very relevant for managing your pain itself. So let's talk a little bit more about the emotional piece. Anxiety. So most of my migraineurs struggle with anxiety. We know from the research that it's one of the most common headache triggers. Headache patients are more anxious than those without pain. Many of my migraine patients are depressed. The research says that 40 to 50% of patients with chronic pain are depressed. Well, pain is depressing. And the unfortunate thing is that depression makes pain worse. So you can see how that creates a very terrible, vicious circle. Pain reinforcing depression, depression reinforcing pain. So as I started to say, these strategies that I'm going to share with you will help to address the emotional suffering as well as the actual pain involved in your migraine or headache condition. So what are these three strategies? First, befriend your body. Second, take charge, then give up control. And third, transform your relationship to others and yourself. Okay, so let's go over each one in turn. Befriend your body. So, living with a chronic pain condition, what often ends up happening is the relationship that you have with your body is one that's kind of characterized by animosity, by frustration. You can end up kind of developing an estrangement to your own body, to your somatic sense of self. And this leads to a kind of disembodiment where you're kind of just living from the shoulders up, right? A disconnection from your body, even though you're feeling its pain, right? And then to compound that, which is it's a pretty natural response, right? But to compound that, many people try to cope with their migraine with distraction, by ignoring their bodies. And while that's a strategy that is effective up to a point, it's really problematic in the sense that it will prevent you from hearing what your body is trying to tell you it needs. And you get out of the habit of tuning in and responding appropriately. So to give an example, let's say that you are working at your computer, you have emails to type, and you're in one position for any length of time. Let's say it's 15 minutes now that you've been typing away. And guess what? Your body is actually not developed to sit like that for any length of time. We're not supposed to be that inactive in one position. And your body will start to tell you that, right? So it starts out as a little bit of a whisper, you know, in the form of maybe some tension showing up in the shoulders and neck. Okay. Now, if you paid attention to that message from the body, what would you do? You'd get up. You'd stretch, you'd move your head, and then you'd come back to your task. But many of us don't do that. So what happens as we proceed with our task is now the body needs to up the volume a little bit. And that comes in the form of now muscle soreness. Okay, the body's really going, hey, trying to get your attention here. If again, you ignore that message, there's a good chance that you're going to end up triggering a migraine attack, right? And another way of looking at that is your body saying, I guess I have to scream at you now to tell you that the thing that you're doing is not okay, right? So, you know, there are lots of ways that we can tend to abuse our bodies. Poor ergonomics, poor posture, the inactivity is one that I just mentioned. Also things like over-exercising, right? So not noticing that if you run for 45 minutes, every single time you do that, you seem to trigger a migraine, okay? Or under-exercising, that's also not good for controlling a headache condition. Eye strain, we all know, can be a major trigger. Muscle weakness of your neck and shoulders, upper back, not attending to that, not taking care of that would be a way of ignoring your body. And then the lifestyle issues around sleep. We know that not getting enough sleep can be a migraine trigger, as well as getting too much sleep. We know that certain dietary triggers need to be identified. And we know that we need to stay hydrated. These are just some examples of the ways in which we need to take better care of our bodies and pay attention when the body tells us we need to. Now, if you haven't already noticed, there is a clear connection between stress and migraine. And I want to be clear here. Many of you might have heard early on in your efforts to get a diagnosis or get proper treatment that you were just under a lot of stress, that your headaches were just a result of that, and just relax more, or just exercise more, or just get it together, kind of blaming you. But that's not what I'm saying here. You have a neurological condition, okay? There's a problem in your brain. It's not just stress. However, stress will trigger a migraine, it will make a migraine worse, and it will also maintain a migraine. So a migraine showing up one day, if you're really stressed that day, it can prolong that attack for days. So we all need to be very aware of how stress shows up for us. It's a little different for everyone. Maybe it's a clenching in your stomach. Maybe it's racing thoughts. Certainly it's muscle tension. That is just a physiological fact of how stress manifests. So muscle tension, let's say in the shoulders. And we know that if you don't pay attention and then respond, you can develop what's called sustained neuromuscular tension. And basically what that is we've all seen the person, and maybe it's the person looking back at you in the mirror, who's walking around like this. And, this initially was a reaction to a stressful thought, right? But you might see this in someone who's not particularly stressed in that moment, but it's become kind of a muscular habit, right? And once again, the body is not designed to be like this. And so if you don't address this kind of sustained tension, this can go on to become something called a trigger point. And we know, probably most of you are familiar with that, these clusters of sort of tied up muscle fibers that really often trigger migraines. Okay, so hopefully you're starting to get a sense of how important it is to befriend the body. But how do we do that? So I want you to think about how you interact with a human friend, right? So what do? We check in, we ask how that person is doing, we listen to the response, and then we respond in some way as an attempt to kind of meet their needs, right? So this is what I'm asking you to do for yourself. So there are lots of different kind of somatic practices that really facilitate this kind of checking in, listening, and responding. And Adrienne did such a lovely job this morning talking or showing us some ways of using yoga. And all of these approaches, yoga, mindfulness meditation, body scan's an example of that, progressive muscle relaxation. These are all ways of tuning into the body and staying connected as you do something, as you move or something like that. And so it helps you develop the ability, the habit of checking in and responding to what you find. Okay, so that was the first strategy. And certainly feel free, if you want more clarification, you want me to go into more depth, please feel free to ask questions in the chat. I'll do my best to answer those at the end. Okay, so strategy number 2, take charge, then give up control. Sounds a little bit paradoxical. Let's talk about the take charge part first. What we know is that you will do the best. Those of you with chronic headache, you're gonna do the best if you don't expect your healthcare providers to fix you without your active collaboration. We know this from the research, we know this from our own experience treating you. I don't know why there are these strange marks on my slides. I don't know if you guys can see them too. Like there's a little ghost in the machine. Anyway, your job is to seek treatment from those who can help you identify what you need to change. And then you need to take it from there. So don't just sit back, wait for the pills to be prescribed and hope everything's gonna get better. You need to be an active collaborator in your treatment. So that's the take charge part of this strategy. Now, what about the give up control part? Some may hear that as, are you asking me to resign myself to this condition, to this suffering? And that's not at all what I'm saying. So resignation is giving up trying to help yourself, becoming passive. And that there's nothing that could be further from the truth as far as what I want you to be practicing, what's going to be effective, right? So not resignation, but acceptance. And any of you who practice mindfulness, you know that this is a huge part of that practice. So what is acceptance? Well, in this case, it's, having a mindset like, I'm going to do all that's in my power to influence my migraine condition, but then I will give up my resistance to the fact of my pain. Okay, so let me clarify a little bit what I mean. When we're in pain, we experience a kind of contraction in our bodies, bracing for the pain, but also a contraction in our minds and in our emotions, where you might be hearing yourself say, I don't want this pain. I can't handle this pain. I wish this would go away, right? A pushing away of something that's here right now. And that doesn't make anything better. In fact, it will make your pain worse, right? We just got done talking about how muscle tension will make your migraine worse or will bring on a migraine, right? So just that physical contraction, that tensing when we start to feel a migraine coming on is not useful, nor is the psychological contraction, because that shows up in physical expression, right? But it's also creating an emotional suffering that's now laid on top of your physical suffering. So learning how to practice relaxing into the fact of your pain right now. It doesn't mean you have to like it. It doesn't mean you have to be thrilled that you have a chronic headache condition. It just means in the moment, relaxing into what is here. Maybe you've heard this expression, pain in life is inevitable, suffering is optional. So you all have a headache condition, and now it's your job to learn how to ride that wave. Okay, so moving on to strategy number 3. Transform your relationship with others and yourself. So the psychological roles you play in relationships can contribute to stress, anxiety, depression, and these are all things that are going to worsen your headaches. Let me give you some examples. So many people discover that they experience other people as a threat. Just being around other people leads to anxiety, whether that's because you have a social anxiety disorder or because of some kind of trauma in your background. You have either a conscious or an unconscious sense of not being safe when you're around other people. And what that does is creates, again, this kind of bracing yourself for a blow. And that bracing, which again is unconscious, can develop into muscle tension. And that muscle tension will then likely develop into a headache attack. So what's the answer there? Well, obviously, my preference would be that you see a qualified mental health practitioner to work through these issues, because they're difficult enough on their own, but now we see how they're also fueling your pain condition. Again, it's not why you have your pain, but it's a contributing factor. People pleasers. Any of you out there, people pleasers? I wanted to share a case with you. A gal I worked with a while back in her 60s. She had horrific jaw pain. She could hardly open her mouth to eat. And she also had horrific headaches. And I wanted to tell you a little bit about what I discovered about what was going on in her life that helped us understand what was going on in her face. So she had allowed her adult son and his family to move in with her because he was struggling financially, whatever. And her adult son, had 3 young children. And what would happen is the children would play, as children do, and bring out all their toys and have lots of fun, and then go to another room and start some kind of activity over there. And the son never made a point of asking the children to clean up after themselves or went and did the job himself. This was really hard for my patient because she actually likes a clean, clutter-free environment, and this was her home. And you can imagine that this wasn't the only realm in which her son disrespected her, right? So her reaction to this experience was quite passive. She didn't want to make any waves. She'd had some conflicts with her son in the past, and she hated to make him angry. So I asked her, how are you getting through this? This sounds really hard. And she said one day, I have to grit my teeth to get through the day. Right? This is a turn of phrase, right? This is a metaphor. But it struck me in that moment, this grit my teeth. She was literally gritting her teeth, right? Literally and figuratively gritting her teeth rather than assertively communicate her needs to her son. And, you know, once we were able to identify that and help her process like what it would mean for her to be assertive, and maybe that won't be the end of the world, maybe she can tolerate that, maybe the relationship can tolerate that, she had quite a different experience of her pain. Things started to loosen up and she really did much better. All right, the rescuer. This is when your sense of self-worth comes from fixing others' problems. So this is very common in the helping professions. Now, there is nothing wrong with having empathy, for being concerned and compassionate, and even being upset and sad when someone you care about is struggling, right? I'm not suggesting you shut down your feelings or your empathy for others. But when your sense of self-worth comes from that and you feel like it's your job to fix their problems, that's going to be a problem for you. That's when we start to feel pressure to fix it. We might feel frustrated when we feel like that person isn't doing enough to fix their problem. That might even make us kind of angry with them. Like, why are you doing this thing that I told you should do to fix this problem, right? And you may find that just anytime you're with that person or when you're anticipating being with that person, you notice how it riles up your body. You know, you might just end up with a headache after lunch with someone like this. Well, the problem doesn't lie in them. The problem lies inside of you and how you view your own worth. So that's going to be something that's really important to work on, to figure out how you can be a good friend without taking on the responsibility to take away the pain of that loved one. I just wanted to make a note. These are not scientific, psychological personality categories, the rescuer, the people. These are just kind of shorthand to describe some of the ways that we interact with others that can be problematic and lead to increasing pain. Okay. If you're super ultra independent and very self-reliant, and that is a big part of how you see yourself and how you feel valuable, having a chronic headache condition is extra hard because it's really hard to ask for help. It's really hard to say to your spouse, can we order in tonight? I know I've been saying for 3 nights in a row that I would make dinner, but unfortunately I'm having yet another migraine. Can we order in? That's hard for people. So we have to actually practice learning how to be okay with asking for help. That might also mean having the guts to call your healthcare provider when you're experiencing, let's say, side effects from a medication, rather than just, gritting your teeth and waiting till the next visit. We have to be able to ask for help and not feel that that diminishes who we are. If you're a rigid perfectionist, similar thing. You have to figure out how, tying your worth to how much you accomplished today or how high quality it was is going to be problematic, and it's going to create muscle tension that is going to show up in the form of headache. So those are just some examples, but let's talk about what you can do with that. When you start to say, listen, that made sense. I want to figure out what my particular dynamics are with other people. So again, it's not going to be something you're going to figure out over the weekend and you're going to solve, but you can start by just noticing how you feel when you're interacting with others. If you can, and something like a mindfulness practice is really useful for this, but if you can, try to notice in the moment, oh, like I'm feeling like I'm getting some tension here, and I really like this person, and it's just a friendly lunch, but I'm noticing tension. Okay. Or maybe you don't notice it until after you're with someone. But just start to pay attention to how your body feels, what your emotional state is while you're interacting with other people. That's going to start to give you clues. Once you have a better understanding of what your particular dynamic is, that's when you need to choose to commit to relating differently, okay? And after that commitment comes the hard work of changing, right? This can take years, I'm not gonna lie, but it's well worth it. So the work involves, talking to yourself, reminding yourself. My patient, she had to remind herself daily when she started to feel the tension show up, when her family around her was being very disrespectful. She had to say to herself, the world will not come to a screeching halt if I assert myself with my son, even if he's angry, right? And so by bringing the subconscious relationship dynamics to light, and then consciously choosing to relate differently, this allows the mind-body to relax and function optimally. And I just want to make a side note about this photo. These are some headache providers in our program. So on the right in the green is Dr. Lauren Green, and she's one of our headache neurologists. And then to her left is Dr. Soma Sahai, who is the program director and whom you will be hearing from after me. I just chose this photo because they clearly are interacting in a really healthy way, and just it's pure happiness and enjoyment there. Okay, so in summary, we have to remember that the mind and the body are inextricably linked. Okay, so by capitalizing on this interconnection, you can really empower yourself to reduce both the emotional as well as the physical suffering of migraine. Thank you so much. And again, I'm happy to take some questions. And also here's my USC email if you'd like to get in touch. Oh, and I also wanted to just announce that I will be running a headache support group beginning in October with another colleague of mine, a wonderful occupational therapist named Lindsay Reeves. Some of you may know her. And so that'll be starting, it'll be once monthly support group for headache survivors. So you might be interested in that. Yes.
That was extremely beneficial. I think so much food for thought, and I do have some questions for you.
Great.
But I really think that that was an extremely beneficial presentation for our group. You said so many things that stuck in my mind about befriending your body and taking charge but giving control, which is an interesting statement that I think people can think about. So a couple of things for you. How would you advise someone who may recognize stress or the importance of mindfulness in their treatment plan, but say, I just don't have time. I can't fit it in. I'm already maxed out. So what would your advice be on how to deal with that?
Yeah, well, I mean, this is going to sound flippant, but the first thing I would say is, do you have time for a migraine attack? Because you will get one if you don't manage your stress well, and you know this. But to be even more serious, I think probably every single one of us has that exact thought. We are busy people. I don't care what walk of life you're in. I don't care if you don't have a job because your migraine, your headache condition prevents you from being able to do that. You're still busy. I know this. And so I think number one, first have compassion for yourself. This is hard. It's hard to juggle just living through a chronic pain condition, much less making the changes in your life to benefit it. So first just say, okay, this is hard. How am I going to do this? Recognizing that that's just your human difficulty right now. And then I would say, it doesn't take that much time in a day. Like, we all have 20 minutes in our day, I promise you. And 20 minutes is all it takes to practice some mindfulness with all of those wonderful apps out there that do guided meditations, or, walking in your garden or around the block, or playing with your dog. There are lots of ways to manage our stress, and it doesn't have to be a full-time job.
Okay, I think that's really valuable. I think you're right. People tend to think, how will I carve that time out? Well, maybe it means you don't empty the dishwasher, like the dishwasher is still going to be there, or you steal the time from something. You take a look at your priorities. So I think that that's valid advice, number one, to embrace that it's self-care, and self-care should be a part of your daily routine.
Right. And can I just say something to what you just said
Yeah.
that's so great? Yeah, it's going to come back to some of these other strategies, like asking for help. You know, can you ask your spouse, your child, to empty the dishwasher? This is really important for me, that I take care of myself, and I'm also modeling to my children how important it is to take care of themselves, right? So they're all interconnected, all of these approaches.
Very, very valid. Question for you. If you've never practiced, well, first I wanted to throw up a quick poll, if maybe you would stop sharing your screen. I'm just going to throw up a quick poll, launch a poll that asks people, before we talk about how someone who's never practiced mindfulness, what would be your recommendation to start? That's going to be my question to you after we do this poll. But I'm going to launch a poll that's going to ask, how many of you with us today practice some type of mindfulness as part of your treatment plan, whether it be yoga, art therapy, meditation, movement, body scan. Let's just take a moment to, I welcome your response to this, just to see how many of us have already decided that it's an important part of their treatment plan, and how many perhaps just have not either recognized it should be part of their plan, don't know how to fit it in, don't know how to start. I mean, you had so many good suggestions. Again, there's so many different flavors of mindfulness, and that's one of the reasons why Miles for Migraine, in the month of August, we've been offering 2 sessions a week of mindfulness to give people the opportunity to try something new that maybe they haven't thought of, or maybe that they mix up their mindfulness practice. So it looks like, thank you all. I'm going to end the polling. Let's see. Many of you have already implemented mindfulness. I'm going to share the results with you. Looks like many of you have begun a mindfulness practice, and I commend you with that. I think that's great. Some of you have not yet begun one. So to those of you who have not started, or those that are looking for additional ways, a little mix-up, Dr. Axtell, what would you suggest is a good way to begin?
Well, I would say, let's see, a little feedback there. I would say, if you're willing, do me a favor right now and close your eyes and notice your feet. Feel what you can feel in your feet. And then notice that you're breathing. And then open your eyes. And you have now been initiated in mindfulness. You were just practicing 10 seconds of mindfulness. So it's easy to get started. There are so many wonderful resources out there, whether it's an application. I usually recommend the Headspace app or the Calm app, but there are many out there. There are also resources in the community. Just, Google mindfulness meditation, in your neighborhood, and you will find them throughout. So then just explore, have fun.
Good advice. It's that first step, right? Just to try something. So I think you're right. Sometimes we associate a lofty term for it, like I don't have time and I could never do it. And it can be just as simple as getting in your own space and doing some breathing. So thank you for that. What's your thought? I know we didn't speak specifically, but we got some questions about, is it ketamine infusions?
Ketamine.
Ketamine infusions. There's so few centers for that. First, what are your thoughts and findings on effectiveness, and what do you think will happen in terms of making it more accessible?
Okay, so I mostly provide clearance for that treatment for patients who have conditions like CRPS. We're offering that intervention a little bit more for our migraine sufferers now, but it's less well known how patients will respond. there's not as much research or study out there as far as how this affects migraineurs. Now, the other question was how to make it more, yeah, it's not very accessible. I mean, if your insurance doesn't cover it, which frequently it will not, I mean, we will do our best to keep appealing that, but it's quite pricey.
So it's probably tied into need for research, for effectiveness, hopefully launching into more accessibility.
Yeah, but if you're lucky enough to be treated by a team who has a lot of tricks in their bags, you know, that's not going to be the end all be all. There are a lot of approaches that your various providers can take to help you.
Okay, great. Thank you. We could, again, another speaker that we could stay on with all day and get more resources and benefits to the practices that you have found successful, but unfortunately we have to move on. And so thank you so much for being with us. You have offered quite a bit of insight to our community. Thanks again.
Thank you. It's my pleasure.
We're thrilled to have